Great. Welcome to the House Healthcare Committee. It is Tuesday, February 14th. Happy Valentine's Day. And we are continuing our work on suicide prevention. We have with us, we'll have three pieces of testimony today. We're going to start with Andrew Murrell from RAND. And he's the Director of National Collaborative on Gun Violence Research. Hi, Andrew. How are you?
I'm good. Can you hear me?
We can. Yes. Thank you. I think what we're going to do is just quick introduction so you hear our names, and then we'll turn it over to you for your testimony. So, Bobby?
Hi, Bobby Farley-Rubio from Caledonia One. I live in Barnet, and I represent Waterford and Reigate as well.
Alan DeMar, represent Enosburg and Montgomery.
Hi, I'm Representative Alyssa Black, and I represent Essex.
Lori Houghton, City of Essex Junction.
Compliment for me.
A little slow starting today.
No, I'm wondering if you got my computer.
Oh, I have your computer.
So where did it go?
Mari
Cordes from Lincoln, representing Bristol, Lincoln, Moncton, and Starksboro.
Representative Daisy Rebecco, and I represent Winooski.
Melissa Goldman, Wyndham 3, Rockingham, Brookline, and Westminster, which is the Bellas Falls area.
Representative Art Peterson. I represent Clarendon, Wallingford, West Rutland, and Rutland Town.
Great. Thanks, everyone. We're going to turn it over to you for your testimony. Do you want us to hold questions till the end?
My testimony is about 9 minutes long, I think, nine or 10, and it may be easier to get through it if I go straight, and then I'll take any questions.
Great. That sounds perfect.
Okay.
Turn it over to you.
Okay. Well, thank you, Chair Houghton and Vice Chair McFawn, Ranking Member Black, and distinguished members of the House Committee on Healthcare for the opportunity to testify today on what scientific research can tell us about the effects of state firearm laws on suicide. The views I'll share are based on a series of peer-reviewed reports published by RAND as part of its Gun Policy in America initiative, a multi-year effort to better understand the effects of gun laws with the goal of establishing a shared set of facts that support the development of fair and effective gun policies. In this testimony, I'm going to make 3 points. First, Vermont has an unusually high rate of suicide that's associated with Vermont's high household firearm ownership rate. Second, there's good scientific evidence to support the belief that safe firearm storage laws and waiting period laws may reduce state suicide rates among young people. And third, we don't have a comprehensive understanding of the full range of costs and benefits associated with any gun laws. In 2020, Vermont's suicide rate was 35% higher than the national average. Of the 117 state residents who died by suicide in 2020, 60% died of a firearm injury, and almost all of these deaths, 62 of 69, were among men and boys, who have a firearm suicide rate more than 50% higher than the national average. Over the past decade, Vermont's firearm suicide rate among residents 20 and younger has been 47% higher than the national average. In contrast, Vermont's suicide rate involving means other than firearms is only a little higher than the national average. Hunting, sport shooting, and firearm ownership are long-standing traditions in Vermont, a state with one of the highest firearm ownership rates in the country. Indeed, we estimate that in 2016, 47% of Vermont households owned a firearm, which is almost 50% higher than the national average. There's a common belief that firearms are incidental to suicide rates because a person determined to die by suicide will do so whether a firearm is available or not. But there's now considerable evidence that this common sense assumption is mistaken. Suicide attempts with firearms result in higher death rates than other common methods. This high lethality means that those who attempt suicide with a firearm are less likely to have the opportunity to reconsider their decision. This is especially consequential given evidence that suicide is often an impulsive decision. The time between decision and self-harm is typically minutes, not months. These crises usually pass with time, meaning that most people who survive a suicide attempt do not die by suicide later. And this includes people who survive very serious suicide attempts, including, for instance, gunshots to the head. Firearms don't cause people to become suicidal. But once they decide to harm themselves, those who attempt suicide with a firearm are more likely to die. And those without a firearm, who attempt suicide without a firearm, are more likely to never die by suicide. For these reasons, it's not surprising that high firearm ownership rates are associated with high total suicide rates, not just high firearm suicide rates, though they are associated with high firearm suicide rates as well. Could this association be due to firearm purchases by suicidal individuals? Yes, in part it could, but that doesn't appear to explain the association fully. Elevated risk of suicide among firearm owners continues for years after the purchase of a weapon, and the risk extends to family members in the same household who didn't themselves purchase the weapon. Therefore, there's good reason to believe that Vermont's high suicide rate is associated with the high availability of firearms and the known association between availability of firearms and higher suicide rates. Many studies show that firearm laws passed by states and suicide rates tend to move together, but not necessarily that firearm laws cause those rates. Such correlational studies are useful and suggestive, but there are often competing and contradictory explanations for their findings. So to better understand the causal effect of firearm laws, RAND has conducted a systematic review of the scientific literature that uses standardized and rigorous criteria for evaluating whether the literature makes scientific, credible claims about the effects attributable to gun laws. Our most recent update of this review was published last month. Of the 18 laws we studied, we were unable to identify rigorous studies for many of the possible gun law effects. In many cases, we identified some studies, but determined they provided only weak or inconclusive evidence on the effects of laws. When studies met our standards of rigor and provided meaningful evidence, we applied a standardized scoring rubric to rate all such evidence as either being limited, moderate, or supportive, our highest evidence rating. Currently, our review identifies just one law as having supportive evidence of a causal effect on state suicide rates, and several that have moderate evidence for such an effect. Specifically, we found supportive evidence that laws requiring gun owners to store their weapons locked or where children can't access them appear to reduce gun injuries among young people, as well as gun suicides, gun homicides, and gun assaults among young people. Such laws have been implemented in various ways, although there is some weaker evidence that versions that treat violations as a felony may be more effective in reducing childhood deaths than those that treat it as a misdemeanor. Most implementation differences across states have not been rigorously studied yet. We also found moderate evidence that two other laws may reduce state suicide rates: waiting periods and minimum age of purchase laws. Waiting periods introduce delays between the purchase of a firearm and when the buyer can take possession of it. Such delays might give buyers intent on self-harm time to cool down, thereby deterring some impulsive suicidal acts. As with child access prevention laws, there's not yet compelling evidence on, for instance, whether waiting periods of different durations have differing effects on suicide rates. There's also moderate evidence that states such as Vermont that have set their minimum age of firearm purchase above the floor set by the federal law see reductions in firearm suicides among young people. Other laws like extreme risk protection orders or red flag laws do not yet have what we consider rigorous scientific evidence of a causal effect on state suicide rates. But this doesn't mean that they don't have any such effects. Instead, it means that studies of this fairly new legal innovation have not yet been conducted that would clarify what effects, if any, they have on state mortality rates. Vermont's extreme risk protection order law permits only law enforcement to petition a court to have firearms temporarily removed from a person who poses an imminent risk to themselves or others. Other states allow family members or others, in addition to law enforcement, to initiate these petitions. From descriptive studies, we know that when states permit families to petition for temporary removal of firearms, families use this option. Studies in Oregon and Maryland, for instance, show that between 35 and 45% of all petitions in those states were initiated by family members. But even when states do not permit citizens to initiate petitions, it's often family members who contact the police about their loved ones' dangerous behavior. In Connecticut, for instance, researchers found that 41% of their emergency petitions were initially reported to police by family members. My final point is that even where evidence for the effects of gun law is strongest, we generally know about only a subset of the law's outcomes, typically the subset concerning suicides, homicides, and injuries. This is a problem for legislators because there are many other possible effects of these laws that raise concerns among different stakeholder groups. For instance, child access prevention laws have supportive evidence of reducing childhood deaths and injuries, but most states, including Vermont, haven't adopted these laws. One reason may be that some gun owners fear that if their guns are locked up, they won't be able to access them quickly in an emergency. Unfortunately, we know of no rigorous studies that have tried to estimate how often child access prevention laws prevent a homeowner from accessing his or her weapon when it's needed. This could happen, but we don't have the information needed to understand the trade-offs these laws might entail between child lives lost and lives lost due to foregone self-defense opportunities. I'll conclude by noting that more than 700 Vermont residents died of gunshot wounds in the decade from 2011 to 2020. 80% of these deaths were suicides. These 700 deaths represent 17% more people than died in car crashes in the state over the same period. The research I've summarized today suggests that laws preventing the unauthorized access of firearms and those that delay acquisition of purchased firearms may help Vermont reduce its suicide rate. I can't say whether expanding the scope of Vermont's extreme risk protection order to allow petitions by family members might also help bring down suicide rates, though evidence from other states is clear that families that have run out of other options will petition courts for temporary orders against their loved ones if such petitions are available to them. And with that, I will stop and take any questions or pass the mic back to you.
Great. Thank you so much for that clear testimony. And it is on the committee page for everyone to read later as well. Are there any questions? Daisy?
Can you please repeat the variance between car accidents and suicides from that last decade you cited? I think it was 2011 to 2020.
Yeah, no, so I was actually, it wasn't just suicides I was referring to. I said that in the decade from 2011 to 2020, 700 Vermont residents died of gunshot wounds. And those deaths include suicides, but also homicides and accidents. So the total number of people dying from gunshot wounds is 17% more than died in car crashes.
Art?
Yes, thank you for your testimony here. Do we have data that shows how many of the suicides by gunshot were from guns in the home versus guns purchased and then used?
There's research in California that suggests that the vast majority of suicides with a gun are by people who own the gun. And I see that you have Dr. Azrael queued up to give testimony, and I think she has done some original research on this question in Utah as well.
Great. We will hold that question then for their testimony. So remember to ask that again, Art.
Alyssa? And I just wanted to clarify, you had said that there really are no studies currently linking defensive uses with firearms and safe storage.
That's right. We are not aware of any rigorous studies that suggest that that safe storage laws interfere with defensive gun use or don't interfere with defensive gun use. It's not a kind of study that has been conducted.
And I just wanted to clarify and sort of condense a little bit because I am on your website, which is a fantastic website, by the way. I encourage anyone to go peruse it.
Yeah.
So in your review of studies on the issue of suicide, supportive child access prevention laws support that. And waiting periods, it moderately supports.
We judge the evidence to be moderately supportive of the idea that those laws reduce childhood suicides. Yes.
Right. And I know you have licensing and permitting as limited. Oftentimes I tend to think of licensing permitting as also a waiting period, since you have to go through a time period before you get your license to purchase.
Yeah.
And then everything else, all other gun policies appear to be inconclusive.
Yes, meaning that the very most rigorous types of studies needed to assign to attribute changes in these outcomes to the law haven't been done. There's less rigorous evidence, of a kind of correlational, cross-sectional correlational kind of evidence, often for these laws that we don't summarize in this analysis.
And of the two policies that we talked about, child access protection and waiting periods, there is no evidence that they essentially do harm.
We haven't found any studies that demonstrate that they do harm, and that's a statement about the state of the science as much as whatever effects the laws may have.
Okay, thank you very much.
Yes, Mr. Morrill, thank you for your testimony. I have a question based on some statistics that I remember, and it's been about 20 years since I remember these, so I wanted to make sure they're still accurate, or if not, if you could disabuse me of the notion that these numbers are right. But I remember once reading that a gun in a home is 4 times more likely to harm its owner than an outside intruder, and 22 times more likely to harm someone else in the household than an outside intruder. So I guess my question is about the ratios of how often guns are used, for the intended purpose of defending a home from a criminal act versus how many times they're accidentally used or intentionally used for suicide or other harm. I grew up in Miami where every week on the news there was a kid who found a gun and shot his friend, more of a playful accident than an intentional suicide. So these are the numbers that I remember from a long time ago, and I was wondering if they're at all accurate. Yeah,
actually, there's been some more recent research that is much more comprehensive and seems to support those kinds of conclusions. There's been studies of basically all gun owners in California, for instance, that demonstrate that people who own guns are at much higher risk of dying by suicide, as are their non-gun owning partners or family members in the home. And likewise, the partners of the gun owner are more likely to die in a firearms homicide than matched people from the same neighborhood who don't live with a firearm owner. So it does appear that having a firearm in the home is a risk factor for suicide and homicide victimization.
Question. Any other questions, Mr. Morrow? Thank you so much. We really appreciate your time and your information on the research. Thank you very much.
Welcome. Should I stay on the line or should I drop off?
It is completely up to you. If you have time and want to stay, excellent. If you don't, and there's additional questions, we may just reach out to you via email if that's okay.
I'll stay on for a little while longer and then feel free to follow up with me.
Okay, great. Thank you very much.
Thank you.
Dr. Swanson, thank you for joining us today. We are going to have you introduce yourself for the record and then start your testimony, but we'll do a quick round of introductions because I don't think you were there in the beginning. No, and I was going to say, we can just do names. We don't really need towns since they don't know Vermont. So we just want to say your name so they know who we're talking to.
Bobby Farley Rubio.
Alan DeMar.
Alyssa Black.
Lori Houghton.
And Topper McFawn.
Mari Cordis.
Daisy Burbeco.
Leslie Goldman.
Art Peterson.
Great. So Dr. Swanson, if you want to introduce yourself and then start your testimony, and I think we'll hold questions like we did for Mr. Morrill until the end.
Thank you very much. Good afternoon, everyone. My name is Jeffrey
So Dr. Swanson,
I'm a professor in psychiatry and behavioral sciences at the Duke.
Dr. Swanson, can you hear me? You're very shaky. If you hear me, if you can turn your video off.
Turn my video off. I will do that.
Great. If you can start over, thank you.
Okay. Can you hear me okay now?
We can, yes.
Okay. So thank you. Good afternoon, everyone. And thank you for the opportunity to speak to you today. My name is Jeffrey Swanson. I'm a professor in psychiatry and behavioral sciences at the Duke University School of Medicine and a faculty affiliate of the Wilson Center for Science and Justice and the Center for Firearms Law at the Duke Law School. Again, thank you for the opportunity to speak to you today about extreme risk protection orders. I'd just like to say at the beginning, it's sobering for me and sad to be talking about gun violence prevention on another day when we're reeling from the news of yet another mass shooting in a public place. This almost uniquely American recurring nightmare. And these incidents are just they're so disturbing, so terrifying, and so irrational. They're just everything we don't want ordinary life to be. And I'd like to remind everyone that on the day of any mass shooting and the day before and the day after that, an average.
Dr. Swanson, your connection is not good. Chatting with him, Claire.
Cell phone, would that be possible? Let me see if I can do it.
Yes, I think that's possible. Can you set him up, Claire, that he can call in with a cell phone? Let's do that. Claire will reach out to you.
Yeah, I'm in the hotel room and I'm sorry about the Wi-Fi.
Oh, no worries. We'll make it short. Gets worked out.
Okay.
So she is emailing you.
Get email? Okay.
Are you emailing Claire? Yes, she'll be emailing you.
Did you get the house plan? What were you talking about? Why
Not other parts of the country have connectivity
Right.
issues as well.
Exactly.
Okay.
We don't have this testimony anywhere.
No, we do not.
Okay.
Not his.
And someone call in, like, if we're not able to, we can assume Dr. Miller might be able to join in the next.
Okay. And swap them or? Curious. Dr. Swanson, are you there?
Do you want to